Join me as I dive into the shocking truth about uterine cancer and see if I can uncover the facts that everyone needs to know. This is Holistic Living Essentials. Stay tuned as we bring you the hottest tips and tricks to level up your lifestyle. Don't miss a beat and stay to the end. A silent but deadly threat, uterine cancer is a health issue that many women aren't fully aware of. Despite its prevalence, the spotlight often falls on other types of cancer, leaving uterine cancer in the shadows. Understanding it better could lead to earlier detection and more effective treatments, ultimately saving lives. Uterine cancer is one of the most common cancers affecting the female reproductive system. This cancer originates in the uterus, a pear-shaped organ where fetal development takes place. Awareness and understanding of uterine cancer can empower women to seek timely medical help and improve their health outcomes. Uterine cancer, also known as endometrial cancer when it starts in the uterus lining, involves abnormal cell growth that can spread to other parts of the body. There's also uterine sarcoma, a less common and more aggressive form that originates in the uterus muscles or tissues. Endometrial cancer, accounting for about 90% of uterine cancers, is often caught early due to symptoms like abnormal vaginal bleeding. Uterine sarcoma, however, is rarer and tends to be more aggressive, often diagnosed at later stages when it's more difficult to treat. Raising awareness about uterine cancer is essential. By educating ourselves on its symptoms and risk factors, we can empower women to make informed health decisions and seek timely diagnosis and treatment. Uterine cancer primarily affects women over 50 and has two main types: endometrial cancer and uterine sarcoma. Recognizing the differences is crucial for understanding symptoms and seeking appropriate treatment. Endometrial cancer develops in the uterus lining and is more common in postmenopausal women, although it can also affect younger women with obesity or irregular menstrual cycles. Symptoms include abnormal vaginal bleeding, pelvic pain, weight loss, and pain during intercourse. One reason endometrial cancer is often detected early is the clear symptoms it produces, prompting women to visit their doctors sooner. Early detection significantly improves the chances of successful treatment. Uterine sarcoma, originating in the uterus's muscle or connective tissue, is rarer and more aggressive. Symptoms such as unusual bleeding, pelvic pain, and a pelvic mass often appear at more advanced stages, making it harder to treat. Understanding the differences between endometrial cancer and uterine sarcoma helps women recognize symptoms and seek specific treatments, improving their chances of a successful outcome. The main challenge in diagnosing uterine cancer early is that its symptoms can be very subtle, often resembling those of less severe conditions, leading to misdiagnoses. Abnormal vaginal bleeding is the most common symptom of uterine cancer. Postmenopausal women should consider any vaginal bleeding abnormal, while younger women should watch for unusual bleeding patterns. Other symptoms like pelvic pain, pain during intercourse, and unexplained weight loss can also indicate uterine cancer, but are often mistaken for other conditions, delaying diagnosis and treatment. Misdiagnosis is common because the symptoms are nonspecific and can be attributed to other gynecological issues. Additionally, some healthcare providers may not suspect uterine cancer in younger women or those without obvious risk factors. Women need to be proactive about their health by understanding what is normal for their bodies and seeking medical advice if they notice any changes. They should also be persistent in asking for further testing if initial results are inconclusive. Myths and misconceptions about uterine cancer lead to confusion and misinformation, impacting awareness and early detection efforts. One myth is that uterine cancer only affects older women. While the risk increases with age, younger women, especially those with obesity or hormonal imbalances, are also at risk. Another misconception is that Pap smears detect uterine cancer. Pap smears are for cervical cancer detection, and uterine cancer requires different diagnostic methods like transvaginal ultrasounds or endometrial biopsies. Many believe that uterine cancer symptoms are always obvious. However, they can be subtle and easily mistaken for less serious conditions, delaying diagnosis. Dispelling these myths is essential for promoting awareness and early detection. Women of all ages should be vigilant about unusual symptoms and understand the limitations of tests like Pap smears. Risk factors for uterine cancer include hormonal imbalances, obesity, age, and genetic predisposition. By understanding these, women can take steps to reduce their risk and seek early detection. Higher levels of estrogen without a corresponding increase in progesterone increase the risk of endometrial cancer. This imbalance can result from obesity, PCOS, or estrogen-only hormone replacement therapy. Obesity is a major risk factor as excess body fat produces additional estrogen, disrupting the natural hormone balance. Women with PCOS often have higher estrogen levels, increasing their risk of uterine cancer. Age is another significant risk factor, with most cases occurring in women over 50. The cumulative exposure to estrogen over a lifetime and natural aging processes contribute to this increased risk. Genetic factors also play a role, with a family history of uterine cancer increasing an individual's risk. Understanding these risk factors can help women make informed decisions about their health and seek timely medical advice. Awareness of these risk factors empowers women to take proactive health measures, seek early diagnosis, and improve their treatment outcomes. Uterine cancer is a complex disease that requires our attention and awareness. By understanding the risk factors, symptoms, and challenges in diagnosing it, we can take steps to protect ourselves and our loved ones. Remember, education and awareness are key in combating this disease. Thanks for watching, and I'd love to hear from you in the comments below. Have you or a loved one been affected by uterine cancer? Share your thoughts and experiences with me, and if you want to learn more about managing uterine cancer naturally, be sure to check out our blog at holisticlivingessentials.com, where we'll dive deeper into the world of natural remedies and self-care strategies. If you're new here, consider subscribing and don't forget to hit that notification bell and the like button if you found this video helpful. Until then, see you next time.